This is special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
And hi there, it's Sean McMahon back with you for another episode of the Your Health podcast, inviting you to listen and subscribe anytime at cuswestcentral.ca/podcast or on any of your favorite podcast platforms. Well, you've probably heard the old saying, an ounce of prevention is worth a pound of cure. Well, in the spirit of being prepared for just about anything, CUS West Central Montreal has established a COVID-19 prevention team consisting of healthcare professionals from various disciplines, and they'll be providing support and guidance to more than 120 schools, more than 500 daycare centers, and so many other places within the territory. But to find out exactly what they'll be doing and how they'll be doing it, let's welcome Valérie Lahaie to the podcast. Hello, Valérie.
Hi, Sean. Thanks for having me over.
Oh, it's great to have you. Valérie is the Public Health and Partnerships Coordinator for CUS West Central Montreal. So what exactly does the COVID-19 prevention team do, and what types of professionals are on this team?
Okay, well, the prevention team is actually many healthcare professionals from various disciplines that work to making sure that our different partners are aware of all the protocols of the public health department and that they understand how to implement them properly. So the team has 20 people that work full-time, and it's mainly composed of social workers, nurses, community organizers, occupational therapists, kinesiologists, specialized educator, and many support personnel, administrative personnel as well are implicated.
Okay, so it's a very varied team. You have lots of people involved in this.
Yeah, we do. And there's more than 80 people also collaborating. So I could say we have almost 100 persons that are involved.
Okay. Now, I mentioned daycares and schools off the top, obviously very top of mind these days as everybody is going back to the new normal with new routines. But what are some of the other examples of some of the partners, as they're called, across the CUS West Central Montreal territory? Because there's a lot of different types of places that you're trying to help.
Yeah, there is. We're working as well with many community organizations. Community organizations are really important on our territory because they provide services to more vulnerable groups such as elders, immigrants, people that have a more precarious status work-wise. So these community organizations are starting to give some never stopped giving services throughout the first wave, but some of them had to close because they could not maintain their activities with all the protocols that had to be put in place. So they're starting to reopening as well. So they need assistance. And
if I understand this correctly, and correct me if I'm wrong, but the COVID prevention team's approach is essentially twofold, I guess, right? It's both proactive and reactive. And I'd like to maybe start with just getting an understanding of the proactive side, because I know you've got, for lack of a better term, kind of a checklist of sorts based on the type of partner that you're dealing with. So can you explain to me how the team would reach out to a partner and what type of information you would provide to them, and maybe just give us a concrete example of what that process looks like?
Every team member has received training and they are assigned to a specific partner. Then they contact the representative of the facility, and as you mentioned, they review their checklist of the best preventive practices and measures that has to be put in place to reduce the risk of the COVID-19 transmission. So, for example, if we would call the daycare, then the nurse or social worker or the member of the prevention team will go through 6 important measures that must be addressed. For example, hand washing, distanciation between the adults. They're going to look if they have the personal protective equipment. How are they organized to make sure cleaning, sanitizing the objects is done? And they're going to give some ideas to make sure that all the measures will be put in place properly. We have over 1,300 partners that are going to be reached like that. And we did all the daycare, so that's more than 500 daycare that's been contacted. We also follow places of worship, and we have over 250 community organizations that will be contacted. So it's a huge process of being the most proactive as possible, because we believe that doing it, we will decrease the chances that we have more positive cases on our territory.
Right. Well, let's talk about that because, so that's the positive, proactive outreach side of it. But then there's the reactive side. What happens if something happens? And we can't really predict, I'm sure you can't either, what's going to happen. But what happens if and when a COVID positive result is brought to either your attention or, the attention of public health from a partner like a school or a daycare? Number one, can somebody reach out directly to you guys? And what's the process involved if something does in fact happen?
Well, all our partners are informed when the call is finished. We send them the protocols, we send them documentation. So they receive the email of the prevention team, and they can afterwards contact us anytime during the day, week, or weekend. And then we will monitor our voicemail messages and our email 5 times a day and decide what will be the best option and how we can help out. So the support can be as, providing more documentation, making sure that if they need some material, we can assist them on where to get it. We can also go and see if they need some workshops. So if we needed to do a visit, we could go out and see and visit the partner and have a direct contact with them and their employees and go over all the different measures as well. So that's our reactive approach. We can be reached really anytime, and that's because we really want to be there and make sure people know that they can get support as quickly as they need it.
That's the key, right? Is getting the info quickly. I think that's what everybody's a little bit concerned about is, are the channels of communication open, number one, and how quickly can we get and give information? That's got to be the challenge for everybody involved in this process, I guess.
Exactly. It is. And in case of an outbreak, we will be advised of any incident as soon as there's a positive case, even before being an outbreak, because it's important to know the difference between an outbreak and a positive case. We can have a positive case in an organization or within an institution without being in an outbreak. An outbreak is you have a big number in the same area. So if we have an incident or a positive case, then we will be informed, and we are always in communication with the regional department of public health, and there will be then a plan, we'll partnership with them, with a partner and our team to decide what will be the appropriate course of action.
Okay, and what exactly could that look like?
This may include asking our partners, for instance, to visit a COVID-19 clinic, and then we'll let them know which one they could go. We could also do some testing on site. Okay, so that's a possibility too. Listen, Valérie, what I'm getting from all this is that you seem really ready. We are ready, actually, and that's what we learned from the first wave, that the more we can be ready ahead, the more we're going to be efficient once something happens. So yes, we're ready for any scenario possible. Oh, fantastic. Well done. If you'd like more information on the CIUS West Central Montreal Prevention Team, you can go online, visit ciuswestcentral.ca/COVID-19 Prevention Team. Valérie Lahaie, Public Health and Partnerships Coordinator for CIUS West Central Montreal. Best of luck with this going forward, and just keep washing your hands, right? That's what we keep telling people, huh? Thanks, Valérie. Thank you.
You've been listening to special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal. Don't forget to subscribe at ciuswestcentral.ca/podcast or on your favorite podcast platform.